On this episode of The Natural Plastic Surgeon.
When you go to a plastic surgeon's office, if they make you sign on a paper about a certain size, you're in the wrong place. But it's like trying on shoes. You don't just go to a shoe store and buy a size 7 and not try them on.
I think the connection you have with patients is it's really sweet, and everybody here is great and so nice. You guys care about your patients so much.
And that's what people don't understand is when you put an implant underneath the muscle, which we do for most of our breast augmentations,
Exactly.
You get that muscle stretches and the soreness. And if you don't have enough magnesium on board, you get muscle spasms and you get actual tightness pain.
Yeah.
Everybody, welcome to the Natural Plastic Surgeon Podcast. We're on episode 39. I have the pleasure of introducing to you Esme, who is, hello, she is a patient, what would you say? What do we get? Patient care associate is what we are right now.
Patient care specialist?
Patient care specialist, yeah. Here at our practice, okay? So, and not only that, but you've recently undergone breast augmentation by one of our associate surgeons, Dr.
I did, yes.
Okay. So I'm excited to have you on because you had breast augmentation, you work here in the office, and I'm not holding you hostage, am I?
No.
Okay, all right. So you're here to just kind of talk freely.
Yeah,
okay.
definitely.
Okay.
I think it's a great experience for me because before, when you talk to patients about surgery, it's kind of just what you learn and what you see.
Yeah.
But once you're on the other side, it's such a vulnerable experience for sure. So it's there's so many fears that are associated with surgery, especially plastic surgery.
Mm-hmm.
So it's when I get to say, well, I got surgery here done myself by Dr. Yumin. So, you're in great hands. You're going to love your results.
Yeah.
They kind of feel more comfortable when I tell them I'm more than happy to show you my results. Come in, I'll step in the consult for you. And it makes them feel more comfortable for sure.
That's so powerful, Esme, because I preach this to the staff. I was like, imagine if this person is your family member on the table.
Exactly. Yeah.
They're coming in, and imagine if this is you. You've actually had to experience this, which is fantastic because now you kind of know what it's like on the other side of someone coming in and then having to kind of completely trust the office, basically, because it's not just the doctor, it's the anesthesiologist, it's the nurses, it's everything else with your life in your body. That's a major trust thing. It
is definitely. And I tell patients before, when they talk to me about their past consultation experience, I've talked to our staff here about it too. I've explored getting a breast augmentation before I worked here. Probably I was 21 or 22. I'm 25 now, but I explored the option and I never felt comfortable. I clearly didn't go through with it for many reasons. And the offices maybe didn't make me feel comfortable. It seemed very this is what we're going to do. I don't care about your goals. This is what's going to get done. And I always tell patients here at the office, it's whatever your goals are going to be met regardless. Right. And
Isn't that crazy?
It is very crazy. Yeah. And I hear patients tell me oh, I went in for a breast augmentation, a consult, but he told me I needed a rhino and needed lipo. And I'm like, what? It's such a vulnerable experience, and having to get undressed in front of people you don't know, and them kind of
well, how is it getting undressed in front of people you do know?
It's
it's
different.
You just went and half the staff just saw you naked on the table, So
yeah.
Okay, I didn't, but just not all the staff, but the surgery staff did.
Yeah, definitely. Yeah. I mean, the consultation is with obviously Dr. Yumin, who's kind of my boss too, and Caitlin, who is basically, one of my friends and my coworker, but I never felt I don't like what we're looking at, or it felt truly professional in that aspect.
Right.
And even the day of surgery, I felt really comfortable and really calm, which is such a good feeling to have.
It's an amazing feeling.
So, and even when I was there, just laying on the table, you're looking at the lights. The anesthesiologist was super nice. And, Dr. was asking me what song do you want us to play? And I didn't even think about it. And I mean, I'm a huge Taylor Swift fan.
Okay.
So I
did
was
you put a Taylor Swift on?
Yeah, they did. Yeah. And so I felt really comfortable in the experience, and, just based on the feedback that patients give us, I truly know that the experience they're getting is the same experience that I had, even though I'm an employee.
Right.
Yeah.
Well, that's so important. Tell us about you went to other places. They wanted to kind of give you their version of what they thought was best for you. They didn't even pay attention to what you wanted, which I think is a big mistake. To me, my number one hardest job is to dial in, help people kind of figure out what they want for their bodies, and then get them that goal. as
Yeah.
long as it's within, these parameters that I think is kind of safe and natural, then we go for it,
Yeah, definitely. I remember I went probably like 4 or 5 consultations. I only
hmm
met with one of the surgeons, and I met with like nurse.
Really? So you were
Yes,
like meeting with like
like a
not
nurse
even a doctor?
practitioner,
Oh my
and
God.
she gave me a bra to try on, and there were 600 cc's, and I was like, they look kind of big, and she was like, well, it's gonna be placed under the muscle, so it's gonna be. And I was just like, oh, like I don't know, like this doesn't feel right, like. And they were just like, it's fine, like we're the professionals. Like it felt very like whatever you're feeling is wrong. And even when the one time that I did meet a surgeon, it was in Orange County, and he told me, oh, you should get now that you're in, like let's get you set up with lip filler. And at the time, I never thought like I would need lip filler. And I was just like, wait, do I need lip filler? And then like I was just like, why would he like recommend that? And
Yeah.
he asked me if I wanted like inner thigh lipo. And I was like, I was an athlete my entire life. I don't need lipo.
Yeah.
Like,
What sports did you play? I didn't know that.
Yeah, I played soccer majority of my life.
Oh, wow. Okay.
Yeah.
All right.
Yeah.
Well,
So I was like, it's
Dr.
muscle, I swear.
Yeah. Well, that's kind of ridiculous. One of the things I try to do, and the same with Dr. Mead, is we try to focus on, here at Barrett Plastic Surgery, like what concerns people. We're not here to kind of upsell people. I will tell people about stuff that's going to help them heal, like recovery products and drips and stuff like that, and pain medication and stuff like that. But if someone's coming in for a tummy tuck, I'm not going to mention thigh lipo unless they bring it up.
Right.
I'm not going to mention people's lips if they're here for breast augmentation. You know what I mean? Like we're going to keep it on point. I will sometimes mention certain things in facial aesthetics. If we are going to do a rhinoplasty, sometimes we need to balance the face with some chin augmentation or neck liposuction. But that I only tell people that because that comes from a level of expertise of the overall result, that things that they're going to notice after surgery that if they would have known ahead of time, they would have done.
Exactly.
So that's a little bit different, but like to jump around like that, I think that's a red flag.
It's definitely a big red flag. And what I liked about like my consultation experience, and even with the sizing, like Dr. Mean told me, don't fixate on sizing, fixate on like what you want your after to look like. And which is what we tell all our patients here. Like, don't fixate on the size. The sizing is very different for every patient. And, I had a couple of goal photos, and even on the day of surgery, he said, okay, these are your 2 goal photos. Which one do you prefer?
Yeah.
And I said, okay, this one. And he said, okay, if it means we have to go up a little bit, are you okay with that? And I said, yeah, absolutely. If I'm going to get my goal, I'm going to get my goal. So it's just the clear communication that we have with our patients, I think, is what definitely makes us stick out from like other places where it's just kind of like, well, we said 300, so we're going to go with 300.
I know. Right. That's a huge advantage. And I want the listeners to understand this, is that when you go to a plastic surgeon's office, if they make you sign on a paper about a certain size, you're in the wrong place. Because both Dr. Amin and I, we do measurements on our patients, and we come up with a kind of a ballpark range of what will work. But it's like trying on shoes. Okay.
Exactly,
you don't just go to a shoe store and buy a size 7 and not try them on. You know what I mean? It's just like, try them on while you're there. And so that's why we take that time during surgery to do the on-table sizing. A lot of people don't realize that not every surgeon does that, right? You know why? Because they're trying to cut corners. I've
never seen it anywhere
else.
Yeah,
they try to cut corners. They try to speed up their operating time. They brag about their operations. They're 15 minutes in length, and that's ridiculous.
Yeah.
Don't go to a surgeon who's only spending 15 minutes on your breast augmentation. So, we sit our patients up with the sizers in place. We make adjustments, 300, 315, or 325, or 275, or whatever we need to do. And give us the goal photos that goal proportions that you're looking for, and then leave it up to us to figure out the cc's. The easiest thing to do is someone comes and says, I want 300 cc's no matter what.
You're like,
okay, that's easy. Okay. Yeah. I mean, like if you're the expert, like, but there's just no way for people to really know. And so I always try to counsel people when they come in, they have a size in mind. I'm like, okay, that, sometimes they're actually kind of right in a right ballpark, but, your decision, you want the size 300 cc's, or do you want the look? What is it you want? And then
I think
I want
the
the look.
afters are what matter to anybody. And I think naturally, like when you're a patient, even me, like I found myself being like, what if this size is too big, and things like that. But then
I want to talk about that. Like what happened? Did you feel that way anywhere afterwards? How far out are you from surgery right now?
I want to say 8 weeks.
Okay.
Yeah, I want to say about 8 weeks.
Okay. And do you have any regret about your size right now? We did 300 cc's.
Yeah, we did 300 cc's. Yeah. Honestly, I'm so happy.
Okay.
Like I love my results, and I truly got what I wanted. I never had small breast. I just my breasts just weren't the shape I wanted them to be.
Mhm.
I never had like upper pole fullness. And that's what I didn't like because I was like, well, I have to wear a bra all the time. So
Mhm.
I just didn't get what I wanted. So once I finally got like the upper pole fullness that I was looking for, I'm like, oh
Yeah.
my God, I don't have to wear a bra. Like it looks the way I want it to be. And even if I'm not wrong, Dr. Yumeen said he did like a muscle release on me to be able to place them higher.
Yeah.
And I have the upper pole fullness that I wanted and the projection that I wanted.
Mhm.
So it's like, I'm really, really happy.
Right.
Yeah.
I mean, Dr. Mean is excellent, and we both kind of do the same approach in that we spend a lot of time on that perfect pocket placement. And I just want to show you with an implant here really quick that it's getting this in that upper pole position, we release the muscle just a little bit. So you get that little bit of perkiness on the top. And that's the
Yeah.
advantage of an implant versus like fat. Fat's kind of a liquid. I do fat transfer as well. But and that's how implants can be kind of shaped if done properly by a smart plastic surgeon that knows what they're doing. A small implant can make a huge difference because it's what part of the breast that you want to make it
Right.
have the best
Yeah.
result. So that's I'm glad that worked out because we did 300 cc's
Yeah.
and it's like it's not making your breast that much bigger, but it's giving you that shape that you want.
Yeah, because I was like a small C,
Mhm.
and I got measured recently, so it's like I'm a D now.
Okay.
Yeah, and I never went in thinking I want to get a D or I want to be a double D. I think my ultimate goal was just the upper pole fullness.
Yeah.
Like if my breasts stayed the same size, I was okay with that. I just wanted them to be fuller on top, and it's like the confidence that comes with it is crazy.
Yeah.
It does, yeah.
Tell me about that. I want to hear more about that confidence.
Well, like even before, there was just so many things that I couldn't wear, or like I felt like I had to wear a bra, or even I had to get like a strapless bra, and it just doesn't look the same. Like you could see this like the bra, or you could see like we call them like chicken cutlets that you wear to like they're not real chicken
Got
cutlets,
it.
but they're
I
like
know what you're
they're
talking
like,
about. They fit in the bottom and they kind of boost everything.
yeah.
Up. Yeah.
And I just didn't like it. I was just always like complaining about it. And everybody
Mhm.
around me was like, I don't see it, but you see it.
Yeah.
And it's like I was never comparing myself to anybody or was like, oh, I'm trying to look like this celebrity or nothing like that. It was just I was just not confident in my body, like naked, like without anything on. So I feel so much more confident now. Like now I could like, cute bralettes or like I could get like certain kind of tops and,
Mhm.
I don't have to think, oh, well, is my bra going to show or things like that. So it's like, I'm really happy.
Yeah. I mean, I'm so happy for you. I mean, this is why breast augmentation is my favorite operation.
Yeah.
Just like people come in right around this time and they're like, I'm so happy with my results. I'm fitting in clothes. They tag me in photos on Instagram. They tag Dr. Yumeen in photos on Instagram.
Yeah.
It's just a life-changing, experience. And we all get really excited about that. And I know you get excited about that too
Yeah.
when you talk to people on the phone. It's like, here's the place to be because this is going to change your life and it's something to feel good about,
Yeah. I always tell patients that too. And I'm like, I'm really just so happy with my results that I'm like, follow me on Instagram, I'll show you.
Yeah. Okay.
Like,
Amazing.
yeah. And I've had like,
well, what is
patients,
your Instagram? So if you want the listeners to follow you.
it's well, it's honestly like really long. It's like
Okay.
ESSMA and then 4 Ys.
Okay. There you
Yeah.
go.
It's super complicated.
4
I don't know
Ys?
why. 4 Ys.
Okay.
Yeah.
That's easy to find.
I did it in like high school and like now I can't undo it.
All right. It's just
I'm
like,
stuck with
we're
it.
committed to, it's like committed to your Gmail address or whatever.
Yeah.
We'll put it in the show notes so you guys can kind of find that if you want to see how Esme looks on her Instagram. Esme, thank you for sharing that. What are some tips that you have? How did you do recovery wise? Did you use any supplements that we recommended or?
Yeah,
Okay.
I did. So pre-op wise, Dr. Amy wanted me to start on magnesium and the
Yeah.
Heal Fast pre-op.
Yeah.
So I started the magnesium honestly like a month in advance. And
Oh,
then
wow. Okay.
because I hate me personally. I mean, I know you like to work out. I'm not
Yeah.
that person. I don't
Okay.
like to be sore.
It's fine.
I hate the feeling of being sore. So my biggest thing was like I could deal with pain fine,
Yeah.
but being sore, I hate that
Right.
feeling.
And that's what people don't understand is like when you put an implant underneath the muscle, which we do for most of our breast augmentations, you get that
Exactly.
muscle stretches and the soreness. And if you don't have enough magnesium on board, you get muscle spasms and you get actual
Exactly.
tightness pain.
Yeah.
Mhm.
And so I took those two, and then post-op wise, I just took the CBD. I
Okay.
took the post-op, and I took so much arnica.
Okay.
I took so much arnica, but honestly, like, I mean, I'm pretty sure you guys could pull up the footage, but like my first week post-op, I had like no bruising,
Yeah.
like a little bit of yellow, like very little, but even everybody was like, oh my God. And I'm like, no, I'm genuinely taking like a bottle of arnica. Don't do that.
Yeah,
But
yeah.
like I was taking a lot of arnica.
We have arnica pills. We actually started doing the arnica shots. I think
Yeah,
you
and I
just-
took one
did you? Okay.
on like my 10 day,
Yeah.
like day 10, I think I took
Okay.
one of the shots.
Mhm.
And honestly, by like, I want to say like day 12, I had like no bruising, no very minimal swelling, and I felt great. Like even I want to say by day like 4, I could have came back to work because
Yeah.
I felt great.
Yeah.
Yeah.
No, I know we all missed you, but we were really happy for you too at the
I
same
know,
time. We were
yeah.
talking about you and everything. So what's the secret insider scoop on working in a plastic surgery office that you think people should know?
It's a lot of fun.
Yeah.
Yeah, I mean, I've been working for such a long time.
Mhm.
I mean, I've been working since I was like 17 years old. I'm 25 now, and I've
Yeah.
had every job you could think of. But this is honestly my favorite one. I think the connection you have with patients is like, it's really sweet. And, you know, everybody here is great and so nice. Like, it's not like like they just act like that on camera or they just act like that on social media. Like even just talking to you and talking to Dr. Yamin, like you guys care about your patients so much.
Yeah.
And I think that's really important for people to understand that it's like, it's not just like, oh, see you in surgery, never see
Right.
you again.
No.
Yeah. So
Yeah.
I think that's my favorite part about it. And it's also, I think there's a misconception with plastic surgery where people think like you're doing it because the celebrities are doing it or you're
Right.
doing it because your boyfriend is telling you to do it. I want to
Oh, we don't
say
want that.
100% of my patients tell me I'm doing it for myself.
Yeah.
Like you're doing it for yourself, what makes you feel confident. And if you want to go back to how you were before you had kids or you lost a lot of weight or whatever the situation is, like I genuinely feel like plastic surgery gets this bad rep, but I hate to say it, but you truly do it for yourself.
Right.
Like nobody told me,
Most
hey, you
people,
need to do
yeah.
it. Yeah, most people
I
for
know.
sure. Yeah.
Do you have any advice out there for someone who's thinking about getting breast augmentation?
Definitely do your research.
Mhm.
I think sometimes the cheapest deal is not always the best deal.
Well, so that always drives me nuts. People, the first thing to ask for on the phone, you know, from what I hear from you guys is price, and it's just like, don't shop based on price because you're gonna get what you pay for. Don't bargain shop for
Yeah.
parachutes or plastic surgery.
Yeah, and I've seen so many horror stories, and I mean, a lot of our phone calls are revision work.
Oh, yeah.
So, and it's really sad to hear because I mean, you're gonna end up paying that price again, and you might not even get the results you were looking for because of what the first surgeon did.
Right.
I definitely think, you know, techniques are really important. Like asking surgeons, okay, like not just being like, am I going to get the results I want? Like, talk to me about capsular contracture.
Right.
Talk to me about breast implant illness. If you do get capsular contracture, can your surgeon even, you know, fix that? You know, what does your doctor think about breast implant illness? Like, a lot of these situations, you know, happen very rarely, but they do.
Right.
So it's very important, I think, to do your research in the aspect of, is your surgeon qualified for the worst case scenario?
Yeah.
I think that's really important as well.
Right.
Because a lot of people don't think about those things.
Yeah.
And, you know, knock on wood, it rarely doesn't happen here, but
Right.
the
We
option is
We still do
available.
get complications, and
Yeah.
it's all about like we hold our patients' hands when that happens, and that's why I caution people against going overseas for plastic surgery procedures, because you come back, you're not even healed, and what happens if a complication happens? You know what I mean? And it's just like, it's not worth it. Your body and your health. You know, you're not buying a used car. You know, this is your body, and you don't really want to jeopardize it. If you can't afford it, don't worry about it, because it's not life threatening. You know?
Yeah, exactly.
So-
And I'm like, there's always so many options. I'm
I
like,
know.
care credit.
Yeah, I know. You're an expert at that. Well,
Yeah.
Well, Esme, I want to thank you
Yeah.
for being on the show, and thank you for trusting us with your body. If you guys want to speak to Esme, you can call the office, okay? 310-598-2648. She'll tell you more about breast augmentation, and you can check out our Instagram in the show notes. And anything else you want to share with the listeners and the viewers?
I definitely want to share that you know, I love my team and I'm so thankful for everybody here, and definitely just want to shout out Dr. Yamin. I'm so happy for my results, and he's been great. I feel like because I'm so close to him, I've probably been the patient of hell, but you know, I'm just kidding.
No.
I haven't, but he did great, and I'm really happy with my results.
Amazing. Well,
Yeah.
congratulations.
Thank you.
Thank you. And thank you for being such an amazing member of the team.
Thank
and
you.
Thank you for being on
Thank
the
you for
podcast.
having me.
Of course.
It's been
My
great.
pleasure. All right.